Most addiction, how it starts, it could be just of a one-off thing. It could be on a party when people actually want to see what's happening. It could be initial curiosity of what they go through and how they feel with it, and this curiosity can actually kill a person's life by actually making an addict for lifelong. So they start the drug first, and you know that he is in control of what he takes and how much he takes, but later once he gets used to it, the addiction decides how much he takes, what he takes, when he takes, and how does he get all these addictions to take. So addiction seems to be controlling each and everything and each and every domain of a patient, and later this is the same addiction that takes away his life. Somebody who comes with addiction can be a simple case of addiction with a simple withdrawal. When I say it's a simple withdrawal, when you stop something that's addicting, they just have this sort of turks, they have jitteriness, they can have anxiety, they may not sleep well, they can be irritable, they could have mood swings. This is something very easy to handle. Somebody with a complicated withdrawal, this person could have a confusional state, we call this delirium, or they could have seizures, or they could have a major psychotic breakdown when they are actually not in touch with reality. These are the people who need definitive hospitalization, who need a lot of medication. Medications could be initially detox. When you say detox, to block the withdrawal and craving, these are designer drugs that are used to give the similar effect of a substance of abuse and actually make the person comfortable and block the withdrawal phenomena. It also blocks the craving simply because he is comfortable without taking these addictive substances, and he is on a replacement regimen here. Once the detox is complete, there are some addictions where you can give aversive drugs. Suppose he takes this substance of abuse again, it can throw up a very unpleasant sensation. If it's a case like alcohol, when he takes alcohol on top of a tablet called disulfiram, it gives a very unpleasant taste. He starts vomiting, he feels nauseous, he has abdominal cramps, he has low blood pressures, he can have headache, and when they start puking, sometimes they actually end up having blood vomitus. If somebody has a very frail heart, or somebody has a ischemic heart disease, that's to say that he has a hypertension, he's had a heart attack or something like that, these are the people who are prone for a major reaction. Sometimes you can take away life. So these are deterrent drugs. If somebody is motivated to stop but still unable to give it up, can be motivated to take a deterrent substance like disulfiram, and they know the extent of reaction that can happen, they give a consent for taking disulfiram and they agree to take disulfiram and use it. So they act like a policeman. You know you don't want to take it, but when you're outside home, you never know. Situations can be different. Friends can invite you for a drink, and there could be so many situations where you cannot say no. So learning to say no in addiction is a very big program here for us. Somebody with a simple withdrawal case where there's not major problems can be treated in a 2 weeks time. They go through a detox, they are fine, and they all can be at home, and they need to come for follow-up. Follow-up could be for a year's time, because addiction is for a lifetime. You can't say that I am cured of addiction, because you never know, one small setback or one small event can trigger off a reuse of addiction. So it's very difficult. So simple cases also need to be monitored for a longer duration. Somebody with a complex withdrawal phenomena, they will need more than 2 weeks, sometime up to 6 weeks. Somebody who keeps frequently relapsing and ending up taking the substance of abuse again may need to be in a rehab up to 1 year at times, because till that time his motivation is good enough and he's tested out in all the situations which can make him prone to get into an addiction. You need to monitor him. It could be a long duration. You need to work with the families to make sure that this sort of supervision keeps happening, and sometimes families have enabling behaviors. They actually, without their knowledge, are sometimes overcritical. They don't recognize the changes made by the patient or the client, and they don't encourage the patient for remaining abstinent. Sometimes they become critical and become abusive, and they don't recognize small changes made by them. That's when they actually lose hope and they actually relapse. So recognizing these sort of family changes and dynamics is very crucial for managing an addiction program. The street drugs like cannabis or opioids are much difficult to get in olden days, but a prescription drugs, if you have an access to pharmacist, it's very easy to get. These are non-smelly substances. Somebody can take a simple cough syrup or a sedative pill or a painkiller, and nobody knows that how much you're taking and what you're taking. It tasteless, smellless, and nobody can make out, except that there's a change in behavior, there's a change in personality patterns, there's a change in their responsibilities and roles that they take. That's when they realize. Whereas other street drugs is much easier to recognize. you have actually screening tests. You do a urine drug screen, you can find out whether it's taken cannabis or opioids and things like that, or taken the prescription pill at times. These tests were not available earlier. Now it's much easier to screen with a simple urine drug screen. There's not much difference when you look at addictions. All of them work on similar principles of working on a reward pathway. Everything seems to give them a kick or a sense of euphoria or a happiness. That's how all rewards work. And in terms of an addictive substance, that is a street drug or a prescription drug, there's not much difference. They all seem to give them a pleasure. But if you look at the extent of addictions, it's very difficult to estimate a prescription drug addiction, because there are pharmacies where they give without a prescription. Drugs are being dispensed without any indication there, and people tend to abuse it much more. And unless you stop this sort of dispensing, it's impossible to correct this sort of addictions. And in terms of costing, prescription drugs are less costly than the street drugs, and much easier to get if you know the pharmacist and you have an access for them. If you look at most rehab programs, each one has different success rates, because there are some rehabs which follow a principle of not taking people who are not motivated to give up. They actually screen people and have a very strict inclusion exclusion criteria. Somebody who is difficult to manage, somebody who is not actually willing to give up, they don't take these people at all. And in those cases, to demonstrate a success rate is very easy. You can have 50 to 60% success rate with them. But if you look at the major chunk of addiction people, these are the people who don't want to give up. They are comfortable with the pleasure, they are able to afford these addictions, and they are individuals with their own rights. Even the law says if he is not troublesome to the family or troublesome to himself, he is not at harm to the society at large, he should not be treated, because it is his wish, it is his right, and he is using his finances. So it is this chunk of people who are very right oriented, who are not looking at a medical model, who are not ready to look at the adverse effect of an addiction, who are not willing to give up, that becomes a major issue for us. And to demonstrate a change in these people is really tough, and even to have a 30% change in people who are not motivated to give up is a big success rate for us. If you look at the gender difference, there's a lot of gender difference in terms of incidence itself. If you look at alcohol, earlier it would be like, majority of the addicts of alcohol would be males. It would be something like 90:10. If you look at the current conflict, and if you look at what's happening in the last few years, you can see enough number of actually programs that happen on TV that the women folk are not less than men in any way. If you look at a place of a party and think that enough people with glasses using alcohol, so it's almost like it's 30 to 70 now. So 10 has been multiplied by 3 times, and you have 3 times more addictions for alcohol itself. If you look at other addiction that's common in women, it could be a sleeping pill, it could be a spasmoproxyone tablet or a cough syrup. These are something that goes really unnoticed for a long time, and the help seeking behavior among the women is also much less. The male is the one who seeks more help simply because there's a lot of pressure from the families. There's a lot of role disturbance that happens, and he's not able to function optimally in the expected roles that he is assigned, and that's why he becomes dysfunctional, and people are quick to recognize dysfunction. Whereas if you look at women, most of them who are not working can actually cook, and the rest of the time actually do nothing at home and actually get into addiction and become dysfunctional. It goes still unnoticed. The man of the house is absent for most part of the day. By the time he comes back, maybe the addiction effects come down, and the women actually drink more in the morning times compared to men. It could be simply because of hormonal disturbances, and woman's mind is much different. It can't be compared. They're more emotional, they're not materialistic, they're not objective, and if you look at the help that they get at home, they may not be getting required help. There could be a lot of psychosocial issues and stress at home, and this is something that would need to be addressed at the individual level. If it is not addressed, they get into depression much more. A woman has to take care of the family, has to be a daughter-in-law, has to become a spouse, has to be a mother. She's doing multiple roles and dimensions of work here. Very less rewards for whatever she's doing, and when she's not praised, yes, you tend to get into depression and also low moods. Yes, if you look at a typical cycle of a woman, she spends 3 weeks not being in a cycle. She spends 1 week being in an actual estrous cycle. In this 3 weeks, there's definitely a lot of hormone change that happens. You keep having an increasing level of progesterone and a falling level of estrogen. And this progesterone level, when it rises, is supposed to cause low moods. and just before the onset of periods or a menstruation, you tend to get low mood, and once the menstruation happens and it clears off, the low moods gets better. We call this perimenstrual depression. If you look at postpartum depression, somebody who is in pregnancy can have a lot of stress. This is a physiological stress because she's actually having a second life within her. A lot of changes happen. There's a lot of weight change, there's a lot of blood related change, there's a lot of hormone change that happen. She's putting on weight and she's still doing a lot of work at home, and all these things are some changes that she keeps handling. Once she delivers, there's a lot of change in hormone levels. So many hormones falls down, and when the hormone levels falls down, some people who are sensitive, who are not sleeping well, who have a family history of depression or family history of suicide or family history of having a postpartum depression, are the ones who get into postpartum blues. These postpartum blues or just low moods can clear off in 2 weeks time, 4 weeks time when sleep gets regularized. Suppose this does not clear out, they can get into major disturbance of depression. The difficulty with postpartum depression is, like, it often goes unrecognized. We think it is normal and it could be just a low mood or the stress of pregnancy, but when they get severely depressed, they feel life is not worth living, they feel guilty for no apparent reason, they feel death as an option, and sometimes they also execute this sort of death wishes and kill themselves. Suicide is very common with postpartum depressions, and as an extension of suicide, sometimes they smother the babies and kill the babies, and before they get medical attention, they would have attempted harm on the baby or themselves. So it's very important that you monitor somebody who's just delivered at least for the next 2 to 3 months. Her sleep hygiene should be good, some help should be available for them to take care of the baby, and also keep looking at a mood chart. How is she in the morning, how is she in the evening, is she really cranky, is she depressed, does she need any medical help, is something that you must be really watchful. If she's got into one postpartum depression, subsequent pregnancy also she's likely to get into postpartum depression. If the mom has been in depression during the delivery times, the daughter also can be depressed. So there is some indirect evidences and indicators on which you can pursue. It's just a quantum change. If you were to look at just having low moods for a few minutes in a day or a few days in a week, may not be enough to say he's severely depressed or actually reaches the threshold for depression and treatment. Being depressed for most part of the day, for most days in a week and most weeks in a month, is something that we would call a major depression that would need treatment. Depression, basically, if you look at the biology of what happens during depression, there is a lot of changes at the chemical levels. There's a fall in level of serotonin, which is a chemical needed for happiness, fall in level of norepinephrine, which is again needed for happiness, and dopamine. These levels fall down beyond a point where actually the normal neurotransmissions don't happen. It's all to do with the mind and the brain here, and falling levels make them feel more depressed. When they feel depressed, they actually lose the normal energy what they have. They actually don't have the required concentration and attention for doing any normal tasks. They actually don't perceive anything around as pleasurable. Even things that they enjoyed as a hobby and something that was pleasurable becomes not so pleasurable, it becomes boring. They don't have the required energy here, and nothing seems to make them happy and nothing seems to give them the kick and drive here. So it's an all-time low mood with no energy levels, feeling that there's no hope in their life and nothing seems to get better. They feel absolutely helpless, and in severe cases they feel suicidal and depressed. Somebody who's just about depressed, who can manage his day-to-day routine, who is able to actually do his normal chores, can actually work and come back, actually can perform his roles and functions at home, may not need medical interventions. Something like counseling and actually helping him handle his stress is all that he would need. Some form of relaxation, it could be hobby, walking, it could be yoga, dhyana, any form of non-medical intervention that he believes in is good enough. Somebody who is more than this threshold, where it actually interferes with his work at office place, relationships at home, and actually doing simple normal routine becomes laborious and tiresome for him. That's when he's made the threshold for a consultation. Anything and everything that can impact your mind and the body can change the level of chemical levels in the body. It could be a simple thing like an infection. Staying in a hospital can be depressing and stressful to people. It could be going through a relationship and a setback in a relationship, getting into addiction, or without any reason also there's something called endogenous depression. The filters in the body actually maintain the levels of chemicals here. If the filters break down for an inherent defect in the body or some genetic issues, the filters cannot maintain the required concentration. This damage is permanent. For no apparent reason, everything is already in his life. He is predisposed to get into depression because of a hereditary problem, and such people get into depression and you can't find out a cause for it. And these are the ones who need to be maintained indefinitely on medications. When they get depressed, the whole psychological process and the thinking process change, your body activities changes, your whole outlook of life changes, your personality changes, and everything seems to change because everything has a color of the mood here. Once you're happy, everything seems fine. If you're not happy, everything seems negative, and the whole thing is connected. You cannot function being depressed. You can't attend to college, you can't go to work properly, you can't function with optimal potential and abilities. So you will be thrown out of a job if you're depressed. If people tend to respond with a low mood for a situation that demands a low mood, that's normal. If somebody becomes depressed and actually cry for a situation that most people don't cry, that would be an abnormal reaction. It's difficult to quantify, but people who are depressed get easily moved to tears. Small things seem to break them, and they become so helpless they can't express their emotions, and feeling the best way of letting down their emotions is just to cry. And crying definitely makes them feel better. At the end of it, they have a temporary relief of their mood. So crying in depression is healing. Somebody who is more functioning in terms of physical activity are the people who actually don't need a lot of medical interventions, because when you do a lot of physical activity, exercises, and any sort of hobby that involves a lot of rigorous physical activity, the body produces a lot of endorphin, and a lot of positive chemical changes happen in the body. These sort of endorphins have a definitive elevation of the mood, and you definitely feel better. You feel de-stressed. You tend to burn out the negative emotion when you do a lot of physical activity. So it's recommendable that you do a lot of physical activity. However much you can do, you must try and do it, and not be dysfunctional and staying at home. You may actually think there could be a change in their thinking pattern. They can become more philosophical or more religious, because when you have trouble, you look for help, and most of us look for God for help, and that's why they become more religious and ask God for help. When something goes wrong, you have God to blame for, and if you blame yourself, you feel very guilty. So the people do look for God for help whenever they're depressed, and there's definitely change in the theme of thinking and whatever they write. Everything seems to be low mode. If you're saying music, they would prefer to listen music with monotonous music or something with a depressive theme. They could be creative in a sense. They could write paintings which has a depressive theme, and all the paintings that they do can reflect, and people who are sensitive can read the mood in a painting like that. Not necessarily become creative. The theme could be depressed, and the low mood can color most of the things that they do. If you look at the depression and suicide, there's definitely a link. If you were to do something called a psychological autopsy post his death and after he's actually committed suicide, if you go and try to plot his predominant mood, what was he doing, look at his activities, you can actually get a fair idea was he depressed or not. And 80 to 90% of the people who are depressed actually think of suicide. But most of the people who have attempted suicide, the cause remains unknown. You don't know what it was, and what actually precipitated this act of suicide is something very difficult to tease out. But depression and suicide, there's a lot of link. And when you say successful people committing suicide, it's so difficult to connect, but definitely it's possible, because you get so used to success all along. Even small thing that does not assure you success, or a small failure which most of us can handle, the successful people may not be able to handle. It is this setbacks, small setbacks which they're not used to, can actually trigger off a depression. People can be impulsive. At that moment of time, when they feel helpless, they don't think there's any alternative and hope available, they can contemplate suicide. If there's actually some form of help and intervention, somebody talks to them and actually gives them a ray of hope, they actually change the decisions. If you were to look at why people commit suicide, it's all for small frivolous reasons, something that can actually be handled. It is for something like a temporary phenomena. There is a stretch which is temporary, but they think of suicide as a permanent elimination of oneself. We have a control till a point, but after a point when they become depressed and the depression reaches to a severity level, nothing seems to be in our control except taking medical help and taking some interventions and counseling. So if you look at successful people and celebrities, these are people who are highly under stress. every minute seems to matter to them, and from morning till evening they are under tremendous pressure because you seem to be performing at a level which you're not used to, and high levels of stress and workloads can definitely break your back anytime. We can cope, but beyond a point we break down. If you look at most form of medical intervention, it could be simple tablets. These tablets actually take care of the neurochemical disturbances that's actually happened. They elevate the level of serotonin, norepinephrine, which are the basic chemicals needed for elevating the mood. Once the levels become higher, your mood also starts lifting. If somebody who is severely depressed, there are other options like modified electroconvulsive therapy. These are the modified ECTs or the shock treatment that you talk about. This is a very important form of medical intervention for somebody who is very severely depressed. Just giving even 2 or 3 sessions of this sort of modified ECTs can bring out people from severe depression. If you don't treat them, they kill themselves. So somebody who is suicidal, this is life-saving. So this has to be done under medical supervision. But what you see on the TV and what is portrayed in the media is not what ECT is all about. It's a perfectly valid scientific medical form of treatment where you give a low dose anesthesia that's enough to keep him on sleep, and you give a small pulse of a DC joule current here, and that actually restarts the whole mind system. It is equivalent to rebooting the computer system. You switch it on and switch it off, and the whole software gets reloaded. In the same way, your thinking gets reloaded. So modified ECTs is a very useful option for severe depression. It's absolutely painless simply because you get an injection. The injection makes you to go to sleep and you don't realize what's happening. And when the treatment is over, it's only for 1 second. After this 1 second, you don't remember what's happened. You see people who get seizures, they actually lose consciousness, they regain consciousness, they don't know what happened. That's exactly what happens in a modified ECT setup. And people don't have pain, it's absolutely painless except for the prick that happens with the injection. There's nothing else that's painful. You actually have small temporary phenomena like headaches, body aches, and you tend to forget what you've done on that day. This is something that's acceptable, and there's no major side effects with the ECTs. Yes, there's no pill that's been discovered till date without side effects. So as the dictum goes, antidepressants have some small minor side effects. It could be sleep, it could be increased appetite, it could be weight gain. Some people actually having trouble concentrating. Some medicines have simple things like dryness of mouth, headache. These are something acceptable, and I think we should be able to still use it. If you look at medical model of depression, there is a definite chemical disturbance that happens. You need to correct it. Simple thing like exercise, yoga, meditation, all these things can still correct it. But if you see the severe forms of depression, these levels of chemicals are so changed that simple things like that cannot reverse this change that's happening in the brain. The circuits change, the neurochemical disturbances that's changed is a permanent phenomenon. It cannot be reversed. When you use medicine, it's not that you are giving an artificial chemical to the body. What it does is it actually prevents the degradation of the normal available chemicals in the body. For example, if you have 100 molecules of serotonin in the body, it gets destroyed in 2 days time, but when you give the medicines, it gets destroyed in 7 days time or 8 days time. So effective concentration of the chemicals that's there in the body is enhanced. So these are not artificial drugs that's going to change our mindset and think that. When there's a person with depression, we need to give it for at least a good 6 to 8 months or even 1 year of treatment period. After that, you have a choice. The patient and you can sit and discuss. If he does not want the risk of depression again coming back, you should continue a low dose indefinitely and not stop it at all. If somebody is willing to take the risk, you actually reduce 20% of dose every month and reduce and check. When you reduce and check, if there's a tendency to come back, you need to go back to the previous doses. These are absolute requirement. You don't call this addiction because it is prescribed form of treatment. If somebody is taking without a prescription, without an indication, it becomes an addiction. Here it is prescribed, so there is a medical indication. If you look at simple drugs like diabetes, drugs and antihypertensive drugs or medicines for epilepsy or asthma, you take it for lifetime. You don't call this addiction. Why is that you don't call this addiction? Because it's a requirement, it's life-saving. In depression, you may think it's just plain depression, I can take care of myself, but somebody who's severely depressed don't want the pain and suffering of depression. He is going through pain as a punishment. He has not done any fault. For no apparent fault of his, he's been punished, and he goes through such a bad negative mood where he can endanger his life by killing himself. So you should not endanger the person by giving him the risk of relapse. So once the mind has learned to get into depression, he is likely to get into depression again under stress. So you give the benefit of trial discontinuation. If they're not successful, put them back on medications and explain them that this is something that can protect you. It's like an insurance premium that you pay for wanting to be happy in life. It's good to take medication at the lowest possible dose, and please don't think it's an addiction. When you said role of family, there's definitely a role of a family in identifying a symptom of depression or anything to do with psychiatric illness. It is these people who spend a lot of time with the loved ones and the client in discussion here. So they actually can make out small changes like not sleeping on time, not getting up on time, not actually feeling refreshed. So sleep is a very important indicator for quality of life and overall well-being. If they're not sleeping well, if they cannot concentrate well, if they have low mood that actually interferes in their initiation at work or participation in a responsibility, that's when the family can recognize that something is going wrong. He's not his usual self. You can actually go back and see at what time actually this sort of changes are happening. It could be 3 weeks time, 4 weeks time, and when this is pointed out and discussed, if you can actually come out with a reasonable explanation, you can think that you can sort it out yourself. If there's no reasonable explanation why he's not functioning normally, that's when you would need a professional help. Okay, it could be in this sort of low moods or stress can be in response to an actual event that can be happening in a family. It could be a simple disagreement, an argument, or an ongoing marital problem, or a family issue. This is something that you can address in a neutral environment like a hospital setting or a professional setting, and take a help of a counselor. When a third person looks at this in an objective way, a lot of things looks clearer. He is not able to take sides on the patient sides or the family side. He is going to look at it objectively. There is a problem. What needs to be done to fix this problem? So if you can come up with 1 or 2 solutions, either one of it can work. If it does not work, you must actually come back and discuss with the counselor and ask him why is it not working. So if this is not work, he has to generate some other alternatives. So looking at this sort of objective professional discussion can be beneficial in cases where there's an actual identifiable cause, and if the cause is something to do with relationship and issues of understanding, that can be addressed easily. If it's something beyond a relationship issue and there's no explainable cause, then you need to look at the medical intervention. If you look at literature, there seems to be a lot of differences in the social status and occurrence of medical illness or psychiatric illness. They say people in the lower state of people are people prone for psychosis, and people in the higher state are the people who are more prone for depression. And if you look at female sex, they're more prone for depression compared to psychosis, what they say. But if you look at what's happening in the last 15 to 20 years, everything seems to be changing because there's a lot of migration happening. Cities are actually being flooded with people from the rural background, and a lot of people from other states come in here. A lot of culture related changes happen, and simple change in environment, places of staying in isolation from family itself have become a major issue for them to handle. And depression or major psychiatric illness, there's no clear-cut pattern or a change now. It can happen to anybody and everybody. But of course, if you look at depression, for whatever role she's handling, for whatever hormone changes that she goes through, each and everything can be a trouble to her, and she's more prone for depression.